Good evening, my dear students. So, tomorrow's slip test question, blood pressure, I would like to explain in a simple way. So, blood pressure. So, here, definition. What is blood pressure? So, blood pressure is defined as the force or pressure exerted by blood on the walls of the blood vessel. Here the blood is circulating. So here this blood force on these walls is called blood pressure. Then what is the importance of this blood pressure? Blood pressure is very important. So what is the normal blood pressure? 120 by 80. 120 by 80 mmHg or kPa. So 120 is systolic blood pressure, 80 is diastolic blood pressure. Mm means millimeter, Hg means mercury. So R kPa, kilopascals. So these are all our units how to measure. So why it is important? It is important vital organs. What do you mean by vital organs? Means important organs. So in our body, important organs like brain, kidney and heart itself. These are all are very important organs. So if we keep the blood pressure normal, then only the blood will flows to brain, kidney, heart and liver in a suitable speed. The speed should not be more or less. If it is less, these brain, kidney, heart, liver, they will deprived with the energy, oxygen. If it is too fast, then the blood vessels will rupture. So neither too speed or else too slow. It should be adequate. It should be suitable speed so that it can reach these important organs, will supply the blood, supply the energy, supply the oxygen. So that is the reason blood pressure to maintain normal is important. Then so if the blood clot, bleeding areas, if blood vessel, if it is getting damage, then blood pressure will be increased because it has to repair the tissue. Then obviously the pressure will be increased. So there will be a risk if the blood pressure is low to the brain, kidney, heart. If the blood pressure is low means it will flow very slowly. So it will not fulfill the requirements to the heart, brain, kidney. So what will happen? Fainting, then unconsciousness, then leads to coma. So they require continuous energy supply, continuous oxygen supply. These all are required. So here, what is the instrument we are using to measure the blood pressure is sphygmomanometer. Sphygmomanometer. It will come MCQ or filling the blanks. Dash is the instrument used to measure the blood pressure. Sphygmomanometer. Okay. Then we need to explain about the blood pressure. So blood pressure, it differ time of the day and posture, gender or sex, then age. How it will differs? Time of the day. Daytime ఏమైంది? it will increase. During night, it will decrease. Why? Daytime we are doing lot of work. Hence, blood pressure should be more. Night we are taking rest. We don't want that much speed. Posture. So upright posture require more energy. So blood pressure will be more. If you are sitting, the blood pressure should be less. If you are lying down, even the blood pressure goes down. Sex. In females, the blood pressure is less when compared to male. Male, the blood pressure is more. Age. As the age is increasing, the blood pressure will be increasing. So your age, your blood pressure will be around 120 to 80 mmHg, or else 16/11 kPa. So here mmHg. Okay. So as the age is increasing, say if you are coming to the age of 20, 24, it will becomes 130 to 83 mmHg. So as the age is increasing, it will goes to up to 147. If you are coming to the age of 40, 50, 60, this will go high. As the age is increasing, blood pressure also increases. So, but however, we have to keep the blood pressure constant. So here already full aorta. So if you come to the diagram of heart, so this is the heart. So if you have two atriums, two ventricles, from the left ventricle the blood goes to arc of aorta. Then from the right ventricle it goes to lungs. So already full means per minute our heart will beat 22 beats as an average. So all per 1 second the beat is more than 1 per second it will beat. So per minute it is beating 72 times. So means every second the heart is beating rapidly. So if one beat, a moment to moment, already some amount of the blood is reached here. Then next beat, this is again pushing in this arc of aorta. Hence it is said already full. Again the next beat, again it is full. Then here the arc of aorta will expand and it will recoil. That means expand and it will come to normal position. This will continuous entire the arteries. So the blood will circulate throughout the body with constant pressure. Okay, this is the concept of blood pressure. Then let us understand regulation of blood pressure. So how to regulate the blood pressure? So here short-term control and long-term control. So first one is baroreceptors. So baroreceptor mechanism. So it is very simple. Baroreceptors, these are the nerve endings which are located in carotid sinuses in the arc of aorta. And so here this is arc of aorta. Okay, so these are carotid sinuses. So baroreceptors. So baroreceptors are located. They are communicating to the cardiovascular center on the medulla oblongata. Okay. So if the blood pressure goes up, the blood pressure is more than the normal. So they will immediately identify and they will pass the information to the cardiovascular center here. Okay. Then immediately it will take the help from the nervous system. So parasympathetic impulse, it will release the acetylcholine. Acetylcholine function is to reduce the heart rate, to reduce the force of contraction of heart, till it reaches normal. In second instance, if the blood pressure BP is low than the normal, same these baroreceptors, arca phyota and carotid sinuses, they will give the information to the cardiovascular center. Then again the nervous system, here sympathetic nervous system will activate, will release the adrenaline or else epinephrine. Then it will increase the heart rate, it will increase the force of contraction of the heart till it becomes normal. So this is baroreceptor reflex. Next, chemoreceptor reflex. If oxygen levels significantly poor and carbon dioxide level is more, or else pH level is reduced, then the same chemoreceptors also same location, arca phyota and carotid sinuses. So they will give the information to the cardiovascular center. So now what happens? So it will increase the rate and depth. So these chemoreceptors, they will identify the changes. So from the cardiovascular center, so it will increase the rate and depth so that the whatever the accumulated carbon dioxide, it is going outside and it is replaced with oxygen. And third is higher centers in the brain. So higher centers in the brain influenced by emotional states such as fear, anxiety, pain, anger. In all this condition, the blood pressure will be more. By keeping the mind calm, quiet, we can reduce the blood pressure. Okay, next, long-term blood pressure. So long-term blood pressure. So let us understand this one para. If you read, it becomes more easy for you. So whenever this blood pressure, okay, if it is getting down, then renin from kidney, so juxta medullary cells, so these juxtamedullary cells release the renin. So this renin will flows in the blood and reaches the liver. So liver is having the angiotensinogen. So this liver, in the liver cells, angiotensinogen is already stored in the liver. So this renin will go and function on this. This will converted into angiotensin 1. So it is the inactive form of hormone. Okay. So this angiotensinogen 1, it is released in the blood. It is the inactive form. Then ACE. ACE means angiotensin converting enzyme. It is present in the lungs and other tissues. So this ACE, the name itself is indicating it will convert angiotensin. So that means angiotensin 1 to angiotensin 2. So angiotensin 2, it is a potent vasoconstrictor. Potent vasoconstrictor. Vasoconstrictor means which will reduce the lumen size of the blood vessels. Say previously it is, then it is further reduced to this much size. So by this it will increase the blood volume. It will increase the blood pressure to normal. This is one action from angiotensin 2. Another one. So it will stimulate kidney cortex. Okay, so this kidney cortex, it will release aldosterone. Okay, this aldosterone function is reabsorption of water, reabsorption of sodium ions. By reabsorption of water, by reabsorption of sodium, it will maintain the normal blood pressure. This is long term regulation. So the path name is called RAA pathway. R means renin. Where it came? This is renin. Then another A. What is the another A? Angiotensinogen A. And another A. It is aldosterone. Renin, angiotensin, and aldosterone pathway. So this is how you should understand. If you understand this short term control, long term control, you will get 5 marks. So wish you all the best.